Hey, I wanted to talk to you about one of the kind of products that we sell here at Generations Insurance, and we've represented for years and years. It's called a Medicare Supplement. They're also known as Medigap plans, and we find that these are plans that have been very popular for years and years and years. Your parents might have had one. Your friends might have them. They're really popular plans and have been around for quite a while. And I wanted to explain what a Medicare Supplement, also known as a Medigap, is. So Medicare, in this scenario, would be your primary insurance. Remember, original Medicare is made up of Part A, hospitalization, and Part B, medical coverage. Part B is from the federal government, and you have to have Part A and Part B and keep paying your Part B premiums to sign up for what's called a Medicare Supplement or a Medigap plan. Let me tell you how they work. So Medicare Supplement works like this. Think of a train going down the track. And in this scenario, the engine is Medicare, okay? Medicare is the engine on the train. And attached to the engine is the next car. And that's going to be called a Medicare Supplement or Medigap. And I want to use a scenario. So let's talk about, let's say that I'm on a Medicare Supplement policy plan. And I have Medicare as my primary insurance. Remember, it's the engine going down the track first. And I go to the hospital. And let's say I go to the hospital and I'm there for 5 days. In this scenario, because I have Medicare as my primary insurance, remember, Medicare Part A, hospitalization coverage, has about a $1,400 deductible. So if I went into the hospital and I had Medicare alone and nothing else, I would have about a $1,400 deductible for my hospital coverage alone. But let's use that as an example. So I go into the hospital, I'm there for 4 or 5 days, and I have that deductible for Part A. Well, what happens is that Medicare would get billed and they'd say, okay, we're going to pay our portion of the bill, but Casey has this responsibility to pay for. He has this leftover amount that we do not cover, okay? We call that leftover amount the gap. It's the gap in coverage. Medicare is going to cover their portion. The leftover amount we call the gap. And so that gap can be covered by a private insurance company called a Medicare Supplement or Medigap plan. So in this scenario, I would pay a private insurance company, and there's lots and lots of them out there. We represent lots of them in 6 different states. But anyway, Medicare would get billed first. They'd pay their portion, and then depending on what plan you pick for Medicare Supplement, they would pick up a portion or all of that leftover amount. That's why they're called Medigap plans. They fill in the gap of what Medicare approves but doesn't pay. Okay? And there's all these different plans. They range from plan A as an apple to N as in Nancy. And they're standardized. So it really doesn't matter the company that you choose as far as the coverage. The benefits are going to be the same. But what does matter, and what those companies do get to control, is the premium they charge and the rate of increase that they have every year. But Plan G or Plan F, and those are just 2 of the options, are standard. So whether it's with one company or the other, if they're both Plan F or Plan G plans, they're going to cover the same benefits. They might be different premiums, they might be different rate increases, but they're going to have the same benefits. Okay? So let's go back a little bit. Medicare is your primary. It's the engine of the train going down the track. The supplement is attached to the engine. So when I go to the hospital, Medicare gets billed first, and they pay their portion, and my private insurance company, my Medicare Supplement that I pay a monthly premium to, is going to pick up the rest. Okay? That's called a Medicare Supplement plan or Medigap. Now, one more thing, and we'll talk about it in a different video, is what's called a Medicare Part D prescription drug plan. In this scenario, Medicare and a supplement, Medicare does not allow the supplements anymore to cover prescription drug coverage that you get at the pharmacy. So you have to buy a third policy, another car attached to the train, called a Part D prescription drug plan. Okay? Now, if Medicare is going to cover your prescriptions while you're in the hospital, your supplement will. We're talking about a prescription drug plan for prescriptions you get at the pharmacy outside of a hospital or skilled nursing facility. Okay? So keep in mind, Medicare supplement policies, they've got lots of great options. And they've got great benefits and lots of freedom. There is no list of doctors or hospitals you can go to. As long as the provider will see you as a patient with Medicare as your primary insurance, you can see any provider in the country. Medicare dictates that. So they're the ones that are getting billed first. If you go to a provider that takes Medicare, the name of your supplement doesn't matter. Medicare is the one that's going to get billed. Your supplement's going to follow along with whatever Medicare does. So there's no list, there's no network. You can see any provider that you want to in the country. And you know that if you choose a plan that once Medicare pays, your supplement's going to pick up most of the rest, depending on which plan you choose. Okay? So lots of peace of mind, lots of freedom. If you see doctors out of state, you're a snowbird, you're an RV traveler, you've got kids in other parts of the country that you want to stay with or visit, you know the Medicare supplement, you've got that option to go to any provider anywhere in the country. Now, a couple of the challenges, they're a little more expensive. You've got your Medicare Part B premium you've got to keep paying, you got to pay a Medicare supplement premium, and you've got to pay a prescription drug premium. So, and that can get a little expensive, and so some people would look to what's called a Medicare Advantage plan, which we'll talk about in another video. But great options, well accepted in most areas. In an emergency, you can go to any provider in the country. That's something to remember. But a little more money a month than other options, but something we can definitely explain to you. So Medicare, supplement, and then a prescription drug plan would be the way you'd look at. All right? And again, if you have questions, you can always call us, Generations Insurance. We're at 208-709-9898. Thanks a lot and have a great day.